बिस्मिल्लाहिर्रहमानिर्रहीम। आज का जो वीडियो है इट्स अबाउट scenarios that I came across during my time or interaction with different situations in the hospital, outside the hospital. लेकिन पर्पस इन वीडियोस का ये है कि उससे मैंने क्या लर्न किया, ये क्या नतीजा उससे अखज़ किया, and to share my personal experiences and what I feel could have been done differently or ऐसा क्या किया जा सकता था that would have been better. So let's start with today's video, जो कि it's about challenging medical situations. First scenario was about a burn patient that I came across during my surgical house job. Again, you can come across any difficult patient during your initial part of training or practice. But what happened during this particular time that this patient had a lot of burn and a lot of body area was involved. She was a young girl and her parents were poor and she was managed in the hospital because there was a no burn unit at that time. So what happened is that I was taking care for her. I got attached to her and to her family, providing my best care possible as a house officer. And in the next couple of days, she got some fever and then she died. It was a very big setback for me because I was expecting that she will be improved and she will be able to go home. And I was trying to give them good hope every day, despite she was having a lot of burn. And during the round, one of the consultant who was rounding, he said, I was expecting this from this degree of burn. And I totally crashed on that day. I was like, why my consultant didn't share this information that this patient is having non-survivable burn or degree of burn. So it was very stressful, and I actually cried when that patient died. So it was a big emotional trauma for me, which many patients, many doctors, junior doctors, senior doctors, sometimes they don't realize that it's a lot of psychosocial stress to go through the whole process of listening the misery or problems of the patient on a day-to-day practice. But the question is how it would have been handled nicely. I do agree sometimes patients come in, they are having a non-survivable condition, and despite you work very hard and there is a lot of medical advancement, still you are not able to save that life. But I feel as a senior doctor or senior colleagues should have shared that information with me that this patient is not a survivable patient. You can do what we call palliative care or goals of care discussion, which was not known to me at that time. But I end up having a lot of emotional trauma from the experience. But if it would have been discussed with me, guided me about how it gonna proceed in future, and I may have guided the parents or the family accordingly, if not the patient particularly, still it could have been taken appropriately by the family and they may have been in a better state, not in a shock when that patient died. So I personally believe there is a lot of role in communication, which can help the patient and the family to understand the information. So communication is the key. So there is a French saying that almost 80 to 85% of the time you are not able to cure the patient. You just support the disease process and control it, but you are not able to cure it, which is very true because only infections and certain other medical problems can be cured, but otherwise it's mainly providing supportive care. And that should be taught in the medical school. Scenario number 2, presenting and rounding every day. So during my initial part of house job, as I was very active in patient care and very interested as well. So my immediate senior colleague handed over the patients to me and I was presenting every day. And I was rounding on patients, all the patients, preparing notes, presenting in front of the consultant who's rounding. And it was very stressful again. It naturally worked out well at the end, which I'm going to talk about, but naturally it was very stressful with the burden of the job for someone who is at junior level, trying to provide as maximum care possible and trying to update himself in terms of the medical knowledge, because the junior doctors, what they are lacking or maybe lacking is the extent of the knowledge bank, but they are very enthusiastic, energetic, and active physically, and also they want to learn. So but beside that stress, what I did was utilize that situation in a way that my presenting skills improved, my fear to present in front of the senior doctors like professors, associate professors, that kind of went away. So I'll say any junior doctor who come across a similar scenario, they should have this thing in mind, despite the time is tough, but it gonna improve them and make them a better doctor, better presenter. And that's what it did to me. So it has been very helpful, despite the fact those couple of months to a year was very stressful in terms of the amount of job and how much I was presenting. But I think it should be more titrated according to the doctor or the junior doctor. Some junior doctors may be able to take that much burden or stress, some may not be able to. And the point is not to break the junior doctor, but to have that level of stress or training so they come out fine without hurting themselves psychologically. So thank goodness I was able to make best use of that situation and improve my presenting skills and that fear of senior doctors. Scenario number 3. So it happened with me, and that's some of my audience can correlate with this as well, that the senior doctors sometimes may not behave nice to you. So it happened with me that I was on duty in emergency with my senior colleagues. And as a junior colleague, I was very interested, want to do some minor surgical procedures and whatnot, which is naturally the whole purpose of training. So I was given the opportunity to do a chest tube in the OR. Naturally, it was a big thing for me at the house job level. But what happened, my immediate senior, he, despite the fact he was told that I will be doing the procedure in the OR, he took me in the OR and made me stand in the corner of the operation room. It was a big setback for me. Initially, I was not mentally ready that this gonna happen. I'm very excited. I'm very energetic. I'm trying my best, helping my seniors and trying to show them well in front of the consultants. But when this happened, it was a big setback for me. But what I feel, what happened, I tend to ignore or starting ignoring those immediate senior colleagues and may not like to get in touch with them once I finish my training in that particular position or location. So I just want to say that those seniors or those who have the authority, if they come across a similar scenario, they should remember time passes very quickly. And with those who are junior may become senior or their colleagues in the future. And this is not something nice if you have conflicts, rifts, grudges against each other. But this goes a long way. So any small act of kindness goes a long way. And if you do any wrong thing to someone, that also doesn't go well, especially when you are in medical profession or in any profession, because you're going to come across those colleagues again and again in your future life. So I would say, despite my senior colleague took me in and made me stand, he may have given me some opportunity to perform the procedure. And this is not the end of the world. You may get more opportunities in future, but that junior doctor who may be not going to surgery in future may not have a chance to do it again. And it's a life saving procedure. So one should have the hands-on experience with this. So I think the rightful act would have been that guiding and supervising the junior doctor and not making them or do in a way that they lose that opportunity of learning, which is the whole point of doing the house job or residency. Scenario number 4. Despite I was doing a lot of rounding, physically active with my patient care, providing care, and respecting all my seniors. My head of department, when I went for my final letter recommendation and experience certificate, he said he forgot my name. Again, this may not be unusual for some particular medical location, but again, I can tell you this can happen. It is sometimes possible that I can assure that it was probably not intentional, but it may not have been pitched that way that I forgot your name. It's like, oh, I am so occupied right now. Your name is not coming into my mind. Or why don't you leave your name with me and I'll write it down for you. So there are many ways to handle the situation. But what I would say, if a junior doctor is working with you, please note down their name. They are working very hard to show themselves that they're very energetic and active in patient care. And they're probably looking for a experience certificate or a letter recommendation. So I think it's a duty for the senior doctor that they should remember the name of the junior doctor who worked with them. And I tend to do, because I learned from that experience, that I always have to remember the name of my junior doctors who worked with me. I think it's a good gesture to recognize the junior doctor. So I think it could have been handled differently. Initially, it was not a good feeling that you have been presenting cases to someone and you are rounding with someone every day for a couple of months, and then that doctor, senior doctor, says, "I don't know what your name is." So I think it could have been handled differently, as I just discussed. Scenario number 5. Patient and family gratitude. I just don't want to share all the bad experiences, because there is always good things happening beside the bad experiences. But the important thing is how you're going to learn and implement it in your future life. So I always try to be nice to my patients. Sometimes the patients could be angry, they are frustrated with what's going on, they don't have enough information. And I think more importantly, sometimes they want to recognize that doctor. So it has happened with me many a times, but one little experience I want to share from early times of my medical profession, clinical experiences, that despite I don't share my address with the patient or their family, they still try to give some small gifts or something, which I usually don't accept. But sometimes they become so overwhelming with the amount of care and attention you are giving to them, that they want to pay back in some way, and it makes them happy. So having some small gift or gratitude from them may not hurt. So initially I was very rigid. I don't like to share, I don't like to get anything from anyone. But I think over the time, what I have learned, that having a small gift or small gratitude or a card from someone never hurts. It actually gives good feeling that that patient is, or that family is connected to you, or they want to appreciate you for the care you have provided, or they want to have a photograph with you. And if the hospital policy doesn't conflict in any way, I think it never hurts. Scenario number 6. So I was once in a scenario, I was on my anesthesia rotation, and as I was always active in patient care, so my seniors trusted me. So he once asked me if I can do a private case for him. And because he was senior, he was always nice to me, I agreed. So I went to that private hospital, did that anesthesia case, and for the first time, I realized few things, which I want to share. One thing, that private hospital was not having standard equipment. So private hospital could be many big private institutions, but I can assure you, they, because of the corporate sector issues, taxes, which they try to save a lot of money, they may not be having standard equipment, or it is not maintained appropriately. So that was a big setback when I was working on a very substandard machine and I was providing anesthesia for a patient. So I always say that it's about human life. even those who are working in corporate sector at administrative level, or the businessman or doctors, because it's a combined effort to provide healthcare or appropriate healthcare to someone. So if it's not provided nicely, there could be big setbacks. And I can tell you, I came across patients who have hypoxic brain injury. I came across patients who died because of anesthesia mishandling or surgical mishandling. So please, whenever you get into any practice, please make sure it is safe for the patients. It's not that something you can always kind of lament yourself afterwards, that I may not have taken this case or may not have done it, because then it's gonna haunt you in your life. That case went well, the one I did, but I can assure you I was shivering the whole day why I took that opportunity of helping my senior. So please remember, whenever you agree to help out someone, make sure that you're not hurting another human being. I hope these scenarios will be helpful for the junior doctors around the world, especially in Pakistan, and to guide them how to behave or react, and also for the senior doctors, that how a junior doctor feel in particular scenario. At the end of my presentation, the bottom line is the people who cares and act nice will always be remembered. Those could be patients, those could be seniors, those could be juniors. So life is temporary, life is short. So always try to behave nicely and try to do or be the best of yourself. So please care for yourself, your physical, psychological well being, and also please be mindful of other people's health as well. Thank you very much.